Hello, everyone, and thank you for joining us. We have had several episodes on brain death since the beginning of the podcast. I think maybe five or six, and it's to me it's probably one of the most important topics in medicine that I think we get wrong. But since Anish Koka was not persuaded by my position after all these episodes, we decided to have one where the two of us just argue the point and try to persuade one another or clarify some misconceptions. So here it is, and I hope you will enjoy it. Thank you very much. Let me start recording. Yeah, so you're calling me a jihadist. A jihadist. Where's the accent? Jihadist or
Jihadist,
jihadist?
jihad,
Jihadist
yeah.
for being against brain death. What are your thoughts?
Um,
I mean, it's not totally incorrect.
well, yeah, no, I mean, there's nothing, yeah, I mean, I've come around to the view that there's nothing wrong with being a jihadist if it, means championing certain values to the point of, wanting those values to be imprinted on society, then yeah, I mean, then,
Yeah, but it's
but
not just a matter of values, like a matter of preference. Like I like vanilla ice cream, and I want everybody else to like vanilla ice cream.
No, but there's certain things that come from like it's like you're a holy warrior, right? That's what jihadist is. It's a holy warrior, and so it, 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 so a lot of times when you're speaking about brain death, and you're speaking to folks in the community, frequently in the Catholic community, who agree with you about brain death, and more importantly, this is where to me it doesn't matter. I mean, if you want to call someone not dead because their brain isn't functioning, but they're still breathing on a ventilator and their heart is beating. Okay, but I think the reason everyone is so excited about the definition of when we're declaring somebody dead has everything to do with whether or not we should be allowing the transplantation of organs from deceased donors.
Hmm.
And so that's where things get sticky for me. That it becomes a philosophical question and a medical question, not just a philosophical question, a medical and philosophical question about when exactly does the body die. Um, and then it suddenly turns into, well, if this is going to determine whether or not we have a supply of um, organs for other people that are, dying, um, yeah, then it becomes a real problem for me. So yeah, I know for speaking for myself that if I had some catastrophic injury, um, and then again, there's all sorts of things that are inserted here. But I think again, it's one of these the ends. Everyone here is arguing from the goal here. I mean, I think the whole argument for brain death and when this line is crossed between alive and dead has to do with the fact that people don't. I think there's a predominantly within the Catholic community, there's a group of folks that think that this is wrong and that you should not be taking organs from these folks that were declaring dead and transplanting them. So, and I'm coming from a different angle, saying that I think that's absolutely the right thing to do, and I think that's a moral imperative that we, as a society, allow that to happen. So we're both arguing from those two
Yeah,
places,
yeah.
and that's where the disagreement is. But it gets bogged down into this, like, well, why don't you think this person is alive? Why don't you think? Of course, they're, look, the body heals when you cut it, and is that not alive? It's like,
Right.
okay, yes, fine, but like that
Right.
cannot
So
be,
I mean,
to me, that
you,
cannot be the bar to say whether or not we as a society should make possible organs being transplanted from these unfortunate folks to someone else.
yeah. So as you said, there are many things to disentangle here.
Yeah.
Many things to disentangle. First of all, just for the record, I would say the vast majority of Catholics have no position on this.
Mm.
There's no official Catholic Church position on brain death, and the vast majority, to this day, of Catholic moral theologians that have expressed an opinion have actually come in favor of brain death. So it's by no means a Catholic position to be against brain death, although it tends to be a little bit more common among Catholics, but it's not exclusive. I mean, among the anti-brain death folks right now, there are people from different faith backgrounds, but there's actually a very growing secular anti-brain death contingent, including unlikely allies. Peter Singer, for example, is among the anti-brain death people. And his argument is that, yes, of course, brain dead people are not dead, and we should make sure that everybody's on board with that. It's a charade to call them dead. But I think it's your position, but we should nevertheless be able to take their organs. So that's really the consummate consequentialist position. We had a little show, you and I, against consequentialism. You seem to be completely on board. You said, yes, consequentialism is terrible. And now you're just adopting really a consummate consequentialism, meaning if the end justifies the mean, right? The end of giving organs is good, so good that it doesn't matter.
I would. No, I think, yeah, no, that can be seen in that way, but I think you can cast it differently as well. You can cast it as, because I kind of view it as, and that's what I was trying to get at in the last conversation we had with your two wonderful friends.
Dr. Byrne and
yes,
and Dr.
yes,
Zing,
yes,
right, yes.
Such nice people. They and you know, to me, it's also a matter of, you know, like what would I want in that situation, right? And yeah, I mean, if we, you know, if we're talking about championing a core set of values, and within that core, that value system that we create, it doesn't involve me being allowed, after having a catastrophic brain injury, to say, okay, stop support so that we can, you know, I can move on and give the organs I have, if viable, to someone else. Then yeah, you know, to me, it's why are you, you are now infringing on what I want to do. You know, so it's not purely consequentialist per se. You know what I mean? It's like it has to do with, like, my right says
your autonomy, right? Your prerogative, your freedom to
yeah.
do what you want to do.
Right.
With your body.
I'm not saying that's not
body,
absolute.
My choice.
I'm not saying it's absolute. I'm not saying that I should be allowed. Obviously, I shouldn't be allowed to kill you. I shouldn't be allowed to do many different things. But I'm specifically saying
to do what I want with my organs after when I reach a certain condition.
When I reach a certain condition, exactly. Right. So like I find that I don't think that's
So let's but I mean, these two things can be kept completely separate. For example, Peter Singer would agree with you. He said you should be free to donate your organs, and maybe even if you don't want to donate them, we should take them from you.
No, I don't agree with.
Okay, fine.
Right?
But let's say my point is that
that's an important distinction, right? The important distinction is not that it's not, because if we were a pure consequentialist, then we should say, yeah, we should take prisoners and everyone who's on life sentence. Why even waste dollars on?
They're both consequentialists in the sense, but you scale the consequences differently. You scale the consequences of maintaining your autonomy higher than the consequence of doing good for the greater. You know what I'm saying? I mean, it's still, in a way, it's still a consequential. But my point here, let's just to keep the conversation, you know, relatively clean in terms of which topic we addressed. My point is that the two things can be completely addressed separately. So the question is, are brain dead bodies truly dead or not? Right? And to me, that's the most interesting question.
Yeah.
And then from then on, then we can discuss what to do if they're actually not dead, which is obvious that they're not dead. But legally, the law, the whole arguments behind allowing brain death
but you of all people,
the declaration of death is the fact that according to the law, it's the same one event. There's a single event. There's a single way that you die.
But how can the pagan tell I can't believe that as a pagan I'm saying this. I mean, what does man's law matter, Michelle? Come on, where are you with this? I mean, man's law may say X, Y, or Z, but what is
Yeah.
correct and what is right
No,
and
it's
wrong
true.
in the
It's
eyes
true.
of God is something different.
Absolutely, absolutely, and God will be the ultimate judge.
So,
So
so
it's not. So I'm
man's
doing
law
this.
about
I'm doing this for your own good. I'm trying to. I mean, we. You're right, but I mean, you try to align man's law with the natural law, right?
in
With
this case,
God's
it's
law.
misaligned then.
Correct. It's completely misaligned.
So we should
But
change man's law, not necessarily say, aha, we should on a technicality we are saying alive, not dead, and therefore not allow this to happen. And I think
no. But
not
I don't understand what you're saying here,
no.
because by man's law, I'm talking about this declaration of right.
Yes.
This.
I think we should change it so to say that once somebody gets to a certain condition, we should
Okay.
respect their wishes. So I'm
Okay.
saying that this whole idea that would take out the whole, that would deflate this
Right,
whole,
right.
take out the whole
But
tension
let's
of
talk. Let's talk. I
dead
mean,
alive.
I want to talk a little bit about the what you call the technicality. That so you seem to agree with me that brain dead people are not dead. Are you? Is that fair?
The very people are not dead.
Yeah.
I mean,
Meaning you have a body, a human body with a beating heart on a
right,
ventilator.
right,
There's no detectable brain function to the extent that you can test for it.
right. So you can be
And
brain dead, but you can be alive.
yeah,
Sure.
I mean that's the entire point. That's
Right,
the
right.
entire
So,
point. That
right.
you're
So,
actually alive. You're not dead.
sure, the heart is alive. It's hard to say the heart is not alive.
Correct. The heart is alive, right? And
But, but
but but
are you alive? Or is your
yeah,
soul,
so right, right. So the heart is alive is a figure of speech.
right.
What it is, we're talking about the body. We're talking about
Yes,
the
yeah,
whole thing in front of you, and the whole thing in
yeah.
front of you. And one sign that the whole thing in front of you is alive is that the heart is alive,
Right,
right?
right.
And so, but that's the point. The point is that the whole thing, and then I don't want to get to that point.
Yeah,
That's why I use the term body. I don't use the term person because then people make a
yeah,
distinction between body and person. But
right.
I'm talking about this body because my argument applies to a dog, right? I mean, it would apply to a dog. If you have a dog out of which you
Yeah,
cannot elicit any brain function and the dog is on a ventilator and the heart is beating, I
yeah.
would still say the dog is alive, right? Even though the dog doesn't
Yeah,
have
yeah, but I find it odd that someone of the stances of where you normally sit in the world, that you would argue that this is that I mean this is I mean when the dog was alive, right? The dog ran up to you, the dog
right,
jumped on your lap, the dog
right,
had the dog smiled at you, the dog
right.
moans when you're gone. I mean,
Yeah.
what exactly does it
So
mean to
I'm not.
be technically alive if all of those things are gone?
It means that you're very, very sick or very, very handicapped. So it's a tragedy. It's a tragedy for the dog not to
But the
bark
dog,
and smile
right,
and do doggy things, the things that
right,
you associate with dogs. And so
right.
therefore, but it doesn't mean that the dog is dead. I mean,
But it's very binary though, right? It's like it's one thing to have a
yes,
handicap where the dog doesn't have a leg, misses missing a leg. Say it has some accident, misses a leg, the leg is
right,
gone.
right.
But all those other things remain. Those the ability to interact and
Yes,
derive
right,
joy, the dog's ability to derive joy, the dog's
correct.
ability to give joy. So why? But again, it seems very.
No, so it's
It
a
doesn't
different.
seem
It's a
right
distinction.
to
It's a
to
distinction
say, oh, the brain being gone is a handicap. That seems not
no,
correct.
they're all handicaps. They're all handicaps. It's a very severe handicap. When your brain is gone, it's a very, very severe handicap.
Right.
But it's still a handicap, meaning there's still a dog,
Yeah.
but it's a very, very sick dog. And it requires a lot of care. It requires a ventilator, it requires a feeding tube.
Yeah.
But we can't say that it's not a dog.
But yet there are no dogs that are kept alive like that. But there
Right,
are plenty
okay,
of
okay.
dogs that have other handicaps that are kept alive. Why is that? Is that because we're all bad people?
No, no. I mean, we treat dogs in a certain way that we don't treat humans. I mean, I think that's true of many different things. It's a different
Right.
category of things, right? A dog. But biologically, as far as being a body, as being a living
Yeah.
organism, the
Yeah.
dog is the same to the human being, and therefore,
Yeah.
a dog that doesn't have a brain is just a very, very sick dog. And a
Right.
human person or human body, again, I don't want to use the term person here
Yeah.
just for the sake of the argument. A human body that doesn't have the function of a nervous system is a very, very sick human body. But it's not a dead human body. It's still the same human body that it was moments before. And
Right.
so that's the what you call the technicality, which I think is crucially important because the law wants us to blur that, right? Wants us to actually say, no, it's no longer a human body. That's really what the law says. That's what the defender of brain death have argued successfully to pass the law. And what they say is that it's not a human body. They say it's a corpse, but it happens to be a collection of organs that are kept alive. So it doesn't have anything to do with a human body that existed before, but it's just through the prowesses of modern technology, we're keeping those bodies alive with the ventilator and the intensive care, which makes no sense whatsoever. For many reasons. There are empirical reasons and there are theoretical reasons to dispute the point. And that's why people like Peter Singer have come to realize that and say, no, it really doesn't make sense. It is a body, it's a really severely handicapped body. And me as Peter Singer, I have no problem taking organs from severely handicapped people, because he will do that even with, babies who are born, or aborting, or killing infanticides, right? So he's famous for his defense of infanticides if the babies are severely handicapped. So that's my beef. My beef, it's an important thing, because then, right? I mean, it's telling us the law is a teacher, right? The law teaches us reality. So it's teaching us to make distinctions that are not there, to call a body that is alive, to call it dead and treat it as dead when in fact it is alive. So I think as a just on the pure level of pedagogy, I think it's a big problem. Are you with me there so far? I can get into the arguments, the technical arguments, if you will, that were advanced. So the main argument that was advanced to say, well, if your brain function is no longer, right, if you lack brain function, you're no longer a body, right, you're disintegrated, was because they thought, or they alleged that the brain is, as an organ, functions as an integrator. It's an integrating organ, that the brain functions as an integrator of the body. But that makes no sense, because there's no part that can integrate a whole, right? If the body is a whole, you cannot have a part integrating a whole, because the part itself is integrated to the whole, and therefore the part itself is subject to integration. So philosophically it doesn't work. And then the corollary argument to that was that so it's no longer a body; it's disintegrated, right? Which is what a corpse is. A corpse is it's just a collection of things. It is masked by the ventilator, right? The ventilator gives us the illusion that we're dealing with a body when in fact it is not.
Right.
And that doesn't make sense, because now the brain, which is allegedly the integrator organ, is gone, but you're replacing it with the ventilator, the ventilator is just a bellows, right? I mean, it's a stupid thing. How can bellows contribute to integrate? So the argument doesn't make sense, and then it was disproved by the empirical data, which is people who were diagnosed as brain dead perfectly well according to all the criteria and whatnot. Many of them have survived for years and have shown, as bodies, have shown signs of complete integration, meaning you have a brain dead body that can heal. You have a brain dead body that can go through stages of development from puberty onward. You have brain dead bodies that can gestate a baby, right? You have women who have no, but they can gestate a body. So clearly it's a complete. It's not a corpse. It's not a collection of organs kept alive by the ventilator. It is a body. It is a body. So I think what you're arguing, so if we switch now to the second point of view, you're arguing it's an argument of what we call the argument of personhood. Or or maybe autonomy in your case. Maybe you say, well, I'm still the same person, but I want to be able to give my organs when I'm no longer, when I've reached a certain, level of debility, and be able to do that. That perhaps I have less issues with, frankly. I mean, I don't think it's a good argument. It's an irrational argument. It's a bit of a in essence, it's a form of suicide, because you right, and it's a form of assisted suicide. You're saying, you're declaring at halftime, if I reach this level of mental incapacity, then I want my organs to be donated and I'll be killed in
Yeah.
in the process.
Yeah.
So
Sure.
it's a form of assisted suicide for the
Sure.
good of something else. I think
Sure.
assisted suicide is suicide. I mean, it's in that category of things, and they're sort
Right.
of irrational arguments, really. But I mean, yeah. I mean, at least I'd be happy if the law was changed so that we
Acknowledge what we're doing.
acknowledge what we're doing, right? I mean, so it's that it's true that that this brain death is false. I mean, it's a lie. Paul Byrne was using the term lie, and he's correct. It is a lie. It's not. It doesn't correspond to truth. Now, all of this is so. Just to be clear, also, so
Right.
it's, religious people tend to be sensitive to that. As I said, by and large, most religious communities have had no problem with brain death.
Right.
But it's not a religious argument at all to be against brain death. It's a purely philosophical
Yeah.
argument. It has nothing to do with religion. It's just
But why is it made? Why is it so often made by members of the Catholic community?
Because they're philosophically more sharper, right? I think
It almost seems like
sort of
it seems like we had to demarcate this idea of dead from alive,
yeah.
predominantly so we could assuage the morals of of Christians and Catholics, because I think organ transplant started in the Western world where there was a significant percentage of the population was Catholic, and so once you said they were dead, once medical science could say with some type of certitude that you're dead, now suddenly the establishment, the institutions of the Catholic Church could then say, okay, this person is already dead, so you can do whatever you want. So it's almost a circular thing.
No, it's not. So I think that's the explanation.
Yeah.
The explanation is that certain religions, and some more than
Yeah.
others,
Yeah.
are not. They base their precepts on a certain view of reality, right? I mean, it has
Yeah.
to be to conform. There has to be a conformity to what the reality is. Right?
Yeah.
So if there are moral precepts, you should do this, you shouldn't do that.
Yeah.
Right? These moral precepts are based on a certain understanding of what things are. And
Right.
So that's why it's important, and that's why.
Yeah, but I'm unmoored from that, right? So I don't, so I think Catholics are certainly the establishment.
You're not on more from that. Let's say today. What if I said no? Let me give you an example. What if a law was passed saying that people with brown skin are not human, right? They may look human, but they're not really human, and they should be enslaved, right? Would you say that you're on more from that you don't care, that at the end of the day it's you have to, right? This no, you would try to argue, listen, brown skin is not what distinguishes a human, right? A human from a non-human,
right?
And therefore so there has to be a basis in reality to the moral precepts.
No, I know, but to me, and this is different from what Catholics I think would say. The establishment Catholics, by the way, most Catholics, starting with Pope John Paul, have kind of reaffirmed this idea of brain death and the ethics of transplantation from a Catholic standpoint.
Right, with nuances.
Right.
Even John Paul II said, if the medical community if there's a consensus,
yes, right, and that's why it's so important for medical folks that are Catholic to say no, there isn't a consensus. But anyway, I'm saying that to me, I don't have to hew to that, because whether you're minimally conscious or persistently vegetative, I would take, again, speaking for me, I'm not saying that this is what we should do to all persistently vegetative folks, but speaking for me, if I end up in a minimally conscious state or a persistently vegetative state, whether the legality of it, whatever man's law is, I would say absolutely. I do not want to continue on in a persistently vegetative state. I want to be, I would like to donate my organs and be done with that life. So it is this curious thing when it comes to issues of life.
You cannot do this on your own. You cannot say that on your own. Because you pretend that you don't care what the law is, but the wish that you express, if that wish is going to be enacted, it has to be enacted with the support of the law.
No, I know. So I would say change the law. To change the law and change, I can't change.
So how
I can't change Catholic teachings.
No,
what's that?
But how would you write the law? That's what I want to do.
No, I would give. I would give out time. Yeah, I
So
would give tremendous autonomy to individuals to say, depending on what state they're in, that they can do they can
yeah,
they
but
need to, when they're of sound mind and body, they need to identify what they want done if some catastrophic thing happens, which will not allow them to continue living life in a certain way. And I think there's
yeah,
always going to be difficulty drawing a line somewhere, right?
exactly,
But
exactly.
that's better than not drawing any line and then resulting in a world where look, to me, I think it would be a heinous crime for me.
Yeah,
It would be heinous for me to be locked in a hospital bed after having a stroke, and I don't want that for myself. I know that's not the case for
yeah,
others and whatnot, but in my sound mind and body right now, don't want that for myself. I would consider that as who I was is dead, and I
right.
don't want to continue living like that. And if you and others created a world where I was not able to, do what I wanted to do, then I would consider that, a crime against me.
Yeah,
And so yeah,
right. But it's an irrational argument because you've never been in that situation.
it doesn't
You,
matter. I don't need to
no,
be in situations to know that I don't want to be in situations.
um, no, you do to some extent. You do to some extent. I mean,
We don't.
your preferences. So, but let's say, be it as it may, let's say you have that preference.
Yeah.
You're still you want to change. You want to create a law. You don't like this. You don't like the way I want to change the law, but you want to change the law in a different way. You want to change the law in such a way that it
To
allows
give,
it allows people like you to. And I'm telling you that you cannot do that.
but it doesn't. But
In
it doesn't
practical.
affect you. Well, I mean, if you want to
No,
continue doing it,
no,
but
no.
why? But my law frees us. Your law kind of compels us,
No,
which is a very very
no,
a very
no.
opposite place from where you normally sit.
No, that's not true. Your law will change society. It will change society because again, the law is a teacher. So now you're going to tell the law, everybody can decide for themselves how to compel others to kill them for the purpose of donating organs.
How to compel? You don't know, but I'm not compelling others to kill
Yeah,
kill
no,
me.
no, you're making a will. You're making a will. You're saying,
I'm saying,
in my
please,
will,
please, please do this.
yeah.
And what is wrong
And
with
what,
doing
what
that?
if they refuse? What if they say, no, you're alive and we don't want to do this
Okay,
because we
that's
love you?
fine. Then that's fine. Then find
Then,
some, and then they need to find somebody else. If they can't find somebody else, then
right,
that's fine. But I'm not compelling anyone.
right,
Meaning,
right.
we face this issue with defibrillators and sorry, with pacemakers, right? At the end of life, and like if somebody is in complete heart block, I've never actually turned off a device in somebody that's talking, walking, talk.
Right,
I mean, sorry, talking
right,
and sentient, and turning the device off, the pacemaker off, will make them. And pacemakers, for that reason, don't have an off button. The
right.
only way you can really do that is by
Intervention. You have the
is
immediate
by
intervention of.
reducing the voltage, so you're
Right.
not capturing.
Mhm,
So yeah, pacemakers don't have an off button. I
mhm.
don't really have an off, like, okay, no more pacing. I don't think, at least. But no, I mean, yeah, I mean, I interrogate devices not infrequently now still. But anyway, yeah. So but we yeah. So interestingly, because that would be more active. But that being said, there's plenty of our colleagues, as you know, that would not have an issue with some person who is of sound mind, body, terminal illness, etc. And but again, we're not compelling somebody. It's not like taking a 55-year-old
No,
suicidal person. It's like the judgment of the patient and the clinician
correct.
comes into bear. And I mean, it seems like kind of a beautiful thing that you would kind of want.
Well, not necessarily. Not necessarily.
No?
Let me ask you. Let's say. Um,
So in that one
let's say
case,
let's
you
say
would
let's say you
not
have
allow.
somebody who's let's say somebody is very depressed and they want to stop living. They're very depressed.
Okay.
They're depressed. They want to stop living,
Yeah.
and but they can't kill themselves. They want somebody else to kill them.
Yeah.
And do you think the society should allow somebody to find a murderer to kill them just because they're depressed?
Do I
They don't
think
want to
that?
live. They just don't want to live. They're miserable. They're absolutely miserable.
No, I mean,
They're
I don't. I'm
miserable.
not. Yeah.
They want a
Well,
doctor to
again,
come
I
and help them
think. Yeah, I
end
think
their
if you
lives.
had, if we
And
had
maybe
a
in the process, they will also donate their organs as a bonus.
right, right.
They're
No,
super depressed and
yeah.
they want to die and then they want to donate their organs and you say, this is going to
Right.
be for the greater good.
No, but this is where judgment comes into play, and I think
Yeah.
you have to allow for a certain level of judgment from. What is the point of having a physician class if we are not allowed to make judgments in the best interests of our patients? And sometimes the best interest of our patient may be to let them go, I think moving to a world where that exists more and more is not a bad thing. So
Well,
are there physicians? Yeah, are there
but
physicians?
you haven't answered my question. Would you allow?
If it's an 85-year-old, if it's an 80-year-old that has, or it doesn't matter how old they are. Say
Doesn't
they've been in
matter,
the
right?
hospital. Say they've been in the hospital 12 times because they have small cell lung cancer and
No, no,
they
I'm talking
can't
about
breathe.
somebody
They
who's
can't breathe.
depressed. I'm asking specifically somebody who's depressed,
Just depressed.
just depressed, very depressed, and very, very miserable, absolutely miserable.
Well, again, as a physician, you would try to fix their depression. It is not.
Right,
It's
but
not
what if you
ethical
can't?
to. It's not ethical to. Well,
They've been
no,
on
no, that's not.
12. They've been on 12 antidepressants and it hasn't worked. They've had electroshock therapy and it hasn't worked, and they
Yeah.
really are very depressed.
No, but then why should I do the job for them? I mean, I don't know. We should try to continue helping them. I don't think that. I mean, that all because they've tried 12 times. There's no limit on how many times you've tried.
But
As a
why?
physician,
How different? Why is that different? I mean, that's somebody who doesn't
why
want
is
to
that
live in
different?
that condition. They don't want to live in the condition that they're in. It's not different from what you described. You said, if my brain is not functioning, I don't want to live in that condition, right? So
Right.
these are choices, personal autonomy choices. And
Yeah. No.
why are you making an exception for the depressed guy that you want to help, yet for you, you don't want us to help you. You want us to abide by your wishes.
Well, again, I think we should give latitude to physicians to make those decisions.
No, right, but I'm giving you a very
Yeah. So
specific
no, no. As
example.
a cardiologist, I wouldn't feel comfortable ending someone's life because they have severe depression. Maybe but maybe the psychiatrist community, maybe somebody, maybe they have enough depth of knowledge to say,
Yeah,
okay, there's no hope for this person, and I mean, I don't know, but
there'll be a specialty of suicidists. That they're
suicidists.
specialized, right? They specialize in committing suicide, in helping people commit suicide. Those be the
I
people
think
who are the
that's
most.
very difficult because there the
Yes,
organ the brain is primarily dysfunctional, and you are saying that you cannot do anything to get people out. And we know from experience that like many depressed people who are even attempt to commit suicide many times
right,
are able to live long healthy lives. So I think
right.
you'd have a hard
Okay.
argument to make.
Okay. No,
But
no, no.
that's
So,
very different. That's very different than the natural history of somebody with say end stage heart failure or end stage say cancer, right? That's very different. So allow physicians to make these judgments. Why straitjacket people into these places? So I think,
no,
look, I've had patients that I've known for an incredibly long time,
mhm.
and I've made decisions both ways where they come into a critical care setting very sick, about to be intubated, and someone looks at the chart who doesn't know them that well and says, we shouldn't do this, and the patient can make a decision, right? And I hopefully get a call and I say, no, absolutely, this person is so and so, they were at Disney World a week ago, like we need to try in this
Right.
case. But then there are other times where again, and we are helping, we are making, and I think that's the best thing for patients, that we serve as agents of what they wanted to do. So yeah, I don't see anything wrong
Right.
with that.
Wi- um, but again, I mean, what if people realize that the depressed person is
Yeah.
really, I mean, we've tried to help that person and they're absolutely miserable, and it's
Okay,
year
I'm
after
saying
year
I'm
of
giving
misery.
latitude to some psychiatrists to say that, okay, this
To,
is such a miserable existence, but I don't
such a
know enough
miserable
about
existence
psychiatry.
that we're gonna assist that, terminate that person's life and kill that person.
Yeah, I mean,
Would you allow that? Would
would
you
I
allow that?
allow that?
Right. I
No,
mean,
again, I think you'd have
because
to defer.
you have to write, right? We need to change the law according to your wishes. So I'm trying to
Yeah,
decide
I think,
how you're
yeah.
going to write the
So
law.
we need to defer to we need to give a lot of latitude to patients. So I think if patients, and then you have to have, it takes two to tango. So you have to have then physicians willing to take those things. And I think you're going to have a lot more physicians willing to to ease suffering. It's about easing suffering, and so we're here to, that's what we're here to do, right? We're here to ease suffering.
Yeah.
Easing suffering typically doesn't mean ending somebody's life, but
No, but
there are
right.
particular cases where that can happen. I mean, this is a thought experiment that came up with a priest in the 1700s, right? If somebody is being burnt alive, right, is burning alive, right, and they only have enough, this is a thought experiment, they only have enough water to douse themselves a little bit so that they extend the amount of time, they are going to die. But the only thing you're doing with this little tap of water that you have, this cup of water that you have, that you're pouring on yourself as you're burning alive, is to extend the amount of time that it'll take you to die as you're burning. Then then we shouldn't do that. So extending suffering
No, but
is
that's
not something that we should do. And you can keep somebody alive, right? Keeping somebody alive. That's why you can't look at this as like keeping alive or not. You can keep somebody alive and extend suffering,
okay.
and
Right,
that's not what we're here to do.
But let's make a very, very important distinction here, because
Person is dying.
most people have no problem turning off the ventilator and allowing the person
Yes.
to die.
Yeah.
But that's different from taking somebody's organs and killing them in the process. You understand the distinction?
Right.
Right?
Yeah.
So there's a
Right.
distinction between just turning off the ventilator and allowing somebody to die versus actively doing an action, right?
Oh,
Doing
wait.
an
So
action
if they're going to die without the ventilator,
mm-hmm.
I mean, if they're going to die without the ventilator, and there's nothing reversible about this condition,
Right.
right? This is not an acute pneumonia where you need a ventilator. They're on a ventilator, and in your medical judgment, which can be flawed, but in your medical judgment,
Right.
you cannot come off the ventilator. They are going to die regardless.
Right. But
then why not take those organs and then take the ventilator off and then watch them? I mean,
I have news for you.
It's technical.
Right now, I'm going to die regardless.
Yes.
You are going to die regardless.
Yes.
Right. We're all going to die regardless.
Yes.
Right. So there's no boundary that right. So that's not an argument to allow. Right. So the active to intervene and shorten the person's life. Right. There's no argument to shorten the person's life actively. Right. With the intention of killing them, or the intention of by doing something that intentionally leads to the termination of their lives. I mean, in the case of organ donation, it means taking their heart, taking the heart out from that person. Yeah?
Right.
Yeah.
Yeah, I mean, yeah.
It's a distinction. It's an important distinction.
It's a distinction. I guess I have some questions about how
again, because what you do in all these things, you're making a value judgment, your own value judgment, that the life of somebody who's brain damaged is really not worthwhile. It's a judgment that you have a priori, you have it for yourself, and you say, look, for myself, I wouldn't want to live that way, and therefore it should be okay for anybody who has the same point of view that not having visible mental expressible capacity is not worthwhile. It's not worthwhile, and the distinction that religious people tend to make, and that the secular law used to make up until recently. Now with brain death, in the last 40 years, they ceased to make it, and with abortion, they ceased to make it. They cease to make the distinction, and they start introducing value judgment into which kind of life is worthwhile and which kind of life is not worthwhile. Right. So that's why what we're against and what was very dangerous. Now, of course, we're so used to it that it seems almost second nature now that to make value judgments about certain lives, and that's why in the anti-brain death people, it's not only there are some religious people, but you have a lot of disability advocates, right, who see the danger of this. This sort of mode of thinking, right? Of valuing a certain life, based on,
Right.
And now,
so,
in the scientific world, we elevated the brain as being, the brain is so fantastic. I mean, we identify with our brain. The rest of the body, who cares? It's just I am my brain, right?
Right.
The self, the brain has become the self.
Right.
And so we have this imagination that if the brain is dead, then the self is dead. Which is not true. And by the way, with the conversation with Paul Byrne, you made a comment that we talked about the soul, and you said, this is a religious argument. The soul is absolutely not a religious concept. The soul is a philosophical concept, and it predates its adoption by Christian and post-Christian religious movements. So the soul is just what distinguishes living from non-living, right? So dogs have souls and plants have souls. right? The
Right.
soul. If you realize, if you agree, well, actually, let me ask you that. Let me ask you that question point blank. Is there a real distinction between living and non-living? Is there a real distinction?
There
Or is
is,
it
but the definitions
no,
between that
right?
you and I have
I'm
of
not talking
living
about
vary.
no. I'm not talking about the definition, but I'm saying, is there a distinction? So, meaning, regardless of whether you think about it or not, or how you think about it, or whether somebody even is thinking about it,
Yeah.
is there a real distinction in the universe, in the cosmos, between things that are alive and things that are not alive?
Sure, but again, we're back to yeah, sure,
Yeah,
yes.
yeah, yeah. So there is. So that's all. That's all. That's all. So that's all what the word soul points to. The word soul
Yeah,
is whatever the ingredient is that distinguishes a
yeah,
living thing from a non-living thing. So that's yeah. But it's a question that you have to think about it because again, we many people actually would say no. There's no people who are wedded to Darwinistic evolutionary theory will say no. There's no, the distinction is purely a mental distinction. That is just the human mind that makes a distinction between living things and non-living things. That in fact is just matter. It's just atoms floating about and being rearranged, and it's all the rearrangement of atom. And there's no real distinction in nature between living and non-living. But that really doesn't hold even on sort of scientific terms. Darwin's theory was Darwin presumed that it was a theory only about living things. It was not it was a theory about how
yeah,
living things differentiate and you have speciation. But it said nothing about how you go from the non-living to the living. But people have sort of extended Darwin's theory into a theory that somehow, there's an evolution and you go from non-living to living by waiting billions and billions of years. By the
right.
primordial soup stew. If you wait long enough, then you can go from non-living to living. So, but philosophically that doesn't work. Yeah.
Yeah,
So these things are important. I mean, I'd be very happy to, but I don't know how you would write the law. I mean, you should do this as an exercise. Try to write the law, to have it the way you want it, and not having all the side effects that I think would be present.
that
And would be,
could happen. Yeah,
yeah.
but every law is like that, right? Every law is written with
Correct.
some good intent and then can be abused in some way, and then it that's why the law is so sticky. It's
No,
like
right. It is. It's imperfect. It's always imperfect, but it can be better.
yeah,
There are better laws and worse laws. And a law that says living bodies are dead bodies is a bad law, no matter how you slice it.
yeah.
Right? So
Yeah.
we should get rid of it.
No, I think I agree. I agree that, but before we do that, we have to. Well, no, I guess we don't have to do anything
No,
before we
we
do
don't have
that.
to do
But
anything. We just have to agree that living bodies are living bodies and they're not dead bodies, and that's all. That's all. And really, and the law is not about. There's nothing in the law about organ
yeah,
donation. The law is also for criminal justice, for whatnot, right? I mean, the law has to say there has to be a way that people are declare somebody else dead, right? Because you need it for justice, just for simple justice, and it has to reflect the truth of life and death, that we can distinguish in the world things that are living from things that are non-living. And the law has to be clear about that and not waffle and confuse everything.
well,
Food for thought.
food for thought. Food for thought for sure.
All right, Anish.
All right,
Anything
sir.
else?
No, that's good. That was
Okay.
a good comment. I'm glad I convinced you.
All right. Well, talk to you later.
Alrighty. Yep.
Bye.